thank you so much, especially the Professor Timea Barzo, Director of the Central European Academy, dear professors, part of Central European Academy, dear friends, Diana Gurub and Urban Vertachnik, and also students. I'm very honored to welcome you in my beautiful city. I hope you will have time to discover our small city, because you are coming from much bigger cities, Budapest, Romania, also Bucharest is big one, Bratislava, Brno. We are the smallest. I think I'm coming from the smallest city in our research group. I ordered it just especially for you, the sunny weather during these days. So enjoy also the staying in Maribor. I'm also honored to work with the Central European Academy and esteemed researchers already for 4 years. In last year, in project Assisted Reproductive Technologies, Status de lege lata and Postulates de lege ferenda, we gained a lot of new knowledge, and I'm sure that we also today we will upgrade our knowledge additionally. I participate in this research, and I also wrote a national report about the regulation on the Slovenia situation regarding the reproductive rights to reproduction, reproductive health, assisted reproductive technologies. But I decided today to speak about the reproductive right to reproductive health in a connection with the Sustainable Development Goals. But you will be able to read my national report in the book. We are living in the 21st century, and we are at the crossroads of the rapid medical advancements. Already Orban explained that we are moving very quickly forward, which are opening, of course, new and very complex ethical, medical, legal, social, demographical, religious questions. So we can count forward. And the Sustainable Development Goals laid a new roadmap to improve people's life across the globe until 2030. United Nations General Assembly, there have been 193 nations, in 2015 adopted a global development agenda for next 15 years. A plan of action for people, planet and prosperity entitled the Sustainable Development Goals. Sustainable Development Goals are consisting of 17 goals and 169 targets that are applicable to all countries, small, big countries, rich, poor countries, countries in Europe, countries all around the world. One of the identified goals is aimed to ensure good health, lives, and promote well-being for all people and all ages, and that is the goal about one I will speak mostly in my presentation. That is the goal under the number 3. While the Sustainable Development Goals are universal in nature, with the aim of leaving no one behind, we already heard this parole today, inequalities still derive from nationality, ethnicity, age, gender, sexual identity, sexual orientation, marital status, and so on. These factors all influence one's access to resources and the ability to exercise basic rights, including right to sexual and reproductive health. In most developing countries, the poorest girls and women have the least power to decide whether or when to become pregnant and how many children they should have. They also have the least access to quality care during the pregnancy and childbirth, and this is often resulting in the maternal death. This inequality has lasting consequences for girls and women's health. For example, when the young girl becomes first menstruation, usually in the developing country, that means that this girl will be left the school. She will take out of education. In many cases, it could also happen that this girl will be married. We're also familiar with the child marriages, that also influencing the educational opportunities, and because of the poor education, also poor career and earning potential, because usually the girls are staying at home, and for their contribution to their respective nations' development and the elimination of poverty. Reproductive health and reproductive rights are not only an issue for girls and women living in poverty, they are relevant to every single one of us, women and men, girls and boys, no more than ever in the era of Sustainable Development Goals. I already mentioned this promise, there should no one be left behind, is the central promise of the 2030 Agenda for Sustainable Development and its goals. It represents the clear commitment of all member states to eradicate poverty in all forms, and discrimination in all forms, and exclusion, and to reduce the inequalities and vulnerabilities that people left behind and undermine the potential of individuals and humanity as a whole. But to give the definition, what is reproductive health? I think we should be all aware what is reproductive health, what are reproductive rights, but that is not so simple, for example, in developing countries. Reproductive health concerns the capability of individuals. I already mentioned before that in some girls and women do not have the capability to make own decisions and the freedom to make informed, free and responsible decisions about their reproductive behavior and health. It also includes the access to a range of reproductive health information, goods, facilities and services. So we can see that the right to reproductive health is therefore an integral part of the right to the highest attainable physical and mental health, as such is proclaimed in many international documents which are dealing with the human rights. Maternal mortality is the number of maternal deaths per 100,000 live births, is still significant public concern in developing countries. For example, in year 2020, almost 800 women died from preventable causes related to the pregnancy and childbirth. A maternal death occurred almost every 2 minutes in 2020. We can see that the maternal mortality rate has been dropped for 34% worldwide, but on the other side, there are 95% of maternal deaths still occur in the low and lower middle, that means developing countries in 2020. So the target 3.1 is by 2030 to reduce the global maternity mortality rate to less than 70 deaths per 100,000 live births. What about Slovenia? Where is Slovenia? Slovenia, we have very good system, so I can find the information that the 3 years average maternal mortality rate in 2020 was 4.5 maternal deaths per 100,000 live births. That means 1 death per year. In summary, the Sustainable Development Target 3.1 focuses on significantly reducing maternal death by improving healthcare systems, ensuring access to quality reproductive health services, and addressing the broader determinants of health. Next one, Target 3.7, ensuring universal access to sexual and reproductive health care services, including family planning, information and education, and the integration of reproductive health into national strategies and programs. What is the role in Slovenia regarding this target? Slovenia in 2023 adopted a resolution on the national program for equal opportunities for women and men in the period from 2023 to 2030. The aim of this resolution is to implement monitoring and evaluation of preventive healthcare programs, as well as ensuring access to healthcare, including sexual and reproductive health services for women and girls for marginalized groups. What are the problems? For example, in Slovenia, we are facing with a weak prevention, particularly due to the shortage of gynecologists at the primary healthcare level. So we are inviting doctors from some other countries, for example, for Serbia, to come to Slovenia. So we try to improve this situation. There are still, despite that we are living in a very good organized country, there are still many girls and women from socio-economical disadvantaged families which are more vulnerable, so special attention must be given to these groups of girls. For example, there are groups from Roma communities, there are girls which are coming from immigration families, so they still need much more support as other Slovenian girls. There should be also introducing the free menstrual hygiene product in the public institutions, which should help to prevent women's poverty and break down taboos and stigmatization in the field of women's reproductive health. Also in the field of reproductive and sexual education, we make good steps forward. For example, already in the primary schools, in the first class, the pupils, the students are introduced with the education regarding the sexual education, but that is regarding, for example, how the child at the 7 years of age should be able to recognize sexual violence, whom they should call for help and support. So not about reproduction, of course, at that stage. Then we have target 3.8, that is to achieve universal health coverage, including financial risks, protection, access to quality, essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Slovenia, there's ongoing care for access to safe, effective, affordable, and acceptable family planning methods, including ensuring free contraception and the right to freely decide on childbearing within the framework of mandatory health insurance. Yes, in the last years, Slovenia has been facing with the two very important decisions of the Constitutional Court. And the first one was, it is very briefly explained, was dealing with the age restrictions. For example, Constitutional Court, this decision was related to the issue of artificial insemination and access to medical treatment for women who wish to undergo the procedure but have exceeded the upper age limit, at that time 43 years. The Constitutional Court found that this provision of the law that limits access to artificial insemination for women over 43 years of age is not in compliance with Slovenian constitution. Further, the Constitutional Court found that such an age restriction violates the right to private and family life, and also the court emphasized that the right to fertility treatment means the right to access appropriate medical services unless there justifies reasons to limit these rights. The Constitutional Court ordered the legislature to amend the legislation. The basic point of this constitutional decision was that the access to medical treatment, and especially in our case to artificial insemination, could be based on some restrictions, but these restrictions must be objective medical reasons and not merely the age. The decision is an important step toward greater protection of human rights and equality in access to healthcare services, such, in this case, artificial insemination. The second Constitutional Court decision, there have been two steps, namely in the year 2022, the Constitutional Court makes possible that also the same-sex couples can enter into the marriage and jointly adopt the child. Only 2 years later, so there was the only difference between the same-sex couples and the heterosexual regarding the artificial insemination. So 2 years later, as already Orban mentioned, in October, the Constitutional Court also made the decision and ruled that the ban on access to assisted reproductive technology for the same-sex couples and single women, same-sex couples just for women, is incompatible with the Constitution of Republic in Slovenia. Constitutional Court had that the exclusion of same-sex couples and single women is discriminatory, as it is based on their sexual orientation and marital status. The Constitutional Court found that there was no constitutional permissible ground for such a distinction compared to other couples. Therefore, very briefly said, the part of shortly Infertility Act, there's much longer name, the part which was regulating this should be annulled in the process. So, what is the decision was very important. This decision was an important step towards equality and was part of broader effort towards legal recognition of the same-sex families. By 2030, there should be also the target to end preventable disease of the newborns and children under the 5 years of age. Sustainable Development Goal 3 aims to put a stop to preventable death of the newborn babies, as already mentioned by my prior speaker. Advancements in the assisted reproductive technologies have not only enabled couples and individuals to conceive children before they have been facing with infertility, but also to ensure that the birth of healthy babies free from genetic diseases. There's many possibilities, as already mentioned before, pre-implantation genetic diagnosis. The introduction of such modern assisted reproductive technologies may have a significant role in achieving Sustainable Development Goal 3, namely concretely in promoting healthy lives and well-being for people of all ages. Can we connect, because Sustainable Development Goals are not concretely addressing the art, but we can conclude that this could be also linked to sustainable development, as access to art can be seen and considered as part of achieving sustainability. But what about other goals? For example, Goal 2 and Target 2.2 by 2030 should end all forms of malnutrition, which includes addressing maternal and child nutrition. This has an indirect link to reproductive health, especially in ensuring healthy pregnancies and childbearing. Then we have Goal 6, Target 6.2, also by 2030, to achieve access to adequate and equitable sanitation and hygiene for all and open defecation with special attention to the needs of women and girls in those vulnerable situations. We all know that adequate sanitation is crucial to reproductive health, namely many babies passed away in the developing countries where the sanitation is not such a good quality. And sanitation is especially very important during the menstruation and childbirth. Then we have Goal 10, Target 10.3, to ensure equal opportunity and reduce inequalities of outcome, including by eliminating discriminatory laws, policies, and practices. This target relates to reproductive rights and equality access to reproductive services. So, as the latest constitutional decision was accepted. So, to conclude, improving in connection with availability, accessibility, acceptability, quality, equality, access to artificial reproductive technologies methods can be considered as one of important efforts to achieve Sustainable Development Goal 3. But also other goals are very important to fulfill our Sustainable Development Goals promise. No one should be left behind. Thank you.